Good morning to viewers in Ireland and good afternoon to viewers in India. Today, under India-Ireland Friendship Lecture Series, our guest speaker is Dr. Vijaya Nath Mishra, MD, DN, who is Professor and Head of Department of Neurology in Institute of Medical Sciences, Banaras Hindu University. Dr. Mishra will speak on ICU on the road, Johan Bimar Wahin Upchar, coping with Corona. Apart from his present deployment, Dr. Vijaya Nath Mishra is also chairman of Institute Gymkhana and students advisor for Faculty of Medicine. He was also medical superintendent of SS Hospital BHU. His primary research interests are in diagnosis and treatment of neurological and neurodegenerative disorders, specifically epilepsy, motor neuron disorders, Parkinson's disease. Apart from this, he has also invested himself into the studies related to the benefits and efficacy of River Ganga. His laboratory studies are based on mild cognitive impairments, heavy metal toxicity in River Ganga, and currently he is trying to correlate the neurological disorders with artificial intelligence in order to find better diagnosis and treatment. In addition to being a neurophysician, Dr. Mishra has made 4 feature films on various diseases awareness, that is epilepsy, stroke, MND, that is motor neuron disease, and COVID-19, which have received wide-ranging recognition. Dr. Mishra has published more than 100 research papers in national and international journals. He has received Medical Excellency Award by South Asia Foundation, New Delhi, and has been honored by former Chief Justice of India Supreme Court. He has been organizing several health camps in various parts of India and was a key member to establish such Ganga Research Laboratory at Tulsi Ghat, which is focused to look over the cleanliness of Ganga water. Before I request Dr. Vijaya Nath Mishra for his lecture, I request His Excellency Ambassador of India to Ireland for his introductory remarks. Sir, over to you.
Namaskar. Thank you, Sauji. My warm greetings to all friends who are connected with this program. At the outset, I would like to express my sincere thanks to esteemed Professor Vijaya Nath Mishra ji and his team, Dr. Abhishek Pathak ji and Dr. Varun Singh ji of Neurology Department of Banaras Hindu University for kindly accepting our invitation to share their experience under the flagship initiative of the Indian Embassy, India-Ireland Friendship Lecture Series. This is a new initiative of the Embassy to mark the 75 years of India's independence, Azadi Ka Amrit Mahotsav. Also, this is 100 years of Ireland's independence. So we are in the Embassy looking for innovative ways of strengthening and broadening India-Ireland connectivity and friendship for mutually beneficial partnerships and cooperation. And while we are looking at business opportunities, we are looking at government-to-government, broader partnership, I'm also keen to promote genuine people-to-people learning and sharing and working together, benefiting from each other's innovations in social transformation. And in that context, today's event is very unique and very special for me. On the theme of Corona, we have had a lot of interactive events in India and also other countries because sharing of practices, best practices, and sharing of experiences in dealing with, coping with Corona has been very important part of the global diplomatic initiative. Corona in many ways is truly unprecedented crisis for the entire world. First of all, if you look at the spread, the coverage of this pandemic, it has been truly global. Even compared to the Second World War and First World War, which were relatively limited in their geographical impact, this is a truly global, pervasive tragedy affecting all countries, rich or poor, and even within the countries, it has affected every part of each country. Whether rich, poor, irrespective of social strata. So it has been a truly global, universal challenge for everyone. Secondly, it has not been just a healthcare challenge. It has been a testing time for human life in society economics, trade, national and international engagements. And it has tested the resilience and strength of government institutions, public institutions. It has challenged everything. The normal way of thinking and doing business, normal way of life has been disrupted, and it has provoked all of us to think afresh about how do we deal with contingencies that might appear in the future. And even from the perspective of Corona, even from the global perspective, India's challenge in dealing with Corona pandemic has been truly exceptional, truly unique. We have had such a complex challenge before the nation, uh, because it had taken all of us by surprise. It was a scenario, it was like the way virus was evolving. Nobody in the world was clear about the origin. Nobody was clear about the trajectory, how it is going to evolve. So we were all dealing with huge uncertainty about how to deal with this, what will be effective, what will be not effective, what precautions to take. So everything was so fluid. And look at the complexity of India as a nation. We had to deal not only with the healthcare dimension of the corona pandemic, but also a lot more complex human challenges. For example, we had to provide for very basic healthcare needs to deal with the corona pandemic in terms of PPE and test kits and basic medicines to deal with this. They had to be ramped up very drastically. But also the issue of labor migration. We had to deal with about 6 to 7 million people within India moving from one part of India to other part of India at a time when there were huge uncertainties about lockdown and what kind of precautions and what kind of isolation measures to be put in place. Also, in the global level, we have had to deal with very large scale, unprecedented scale of repatriation from other countries. And under Vande Bharat mission, we have had to deal with about 18, 19 million international passengers their travel to be facilitated. Also, for such a large, diverse, socio-economically like complex society like India, it truly required a dynamic, charismatic, visionary, popular leader like Modi ji to unite the whole country behind one single national common cause of combating corona. And the whole nation, whether it's a public sector, it's a government sector, all ministries, all state governments, on that particular issue, everyone worked with coordination and with same purpose and determination. And not only the country rose to the challenge, we ramped up our manufacturing facilities in a very remarkable manner, not only to take care of our own domestic needs, but also supplying vaccines and medicines and PPEs and test kits to a very large number of countries. Vaccine production was boosted within the country, and we have implemented world's largest vaccination drive. Close to 2 billion doses of corona vaccine have been administered. That would not have been possible without a collective concerted effort. Also, on the international solidarity front, India has been supplying test case, medical consultancies, and all kinds of assistance which we could provide to our friendly developing countries. That has been very much appreciated. So on one hand, the role of the government of India machinery and the state agencies, their role has been properly like disseminated, and there is a greater awareness. But the equally important role of the non-governmental sectors, role of NGOs, the role of civil society leaders, role of grassroots level thought leaders, social pioneers, that also to me is equally important. And that is why when I heard about the very inspiring leadership shown by Professor Vijaya Mishra ji and his team, Dr. Abhishek Pathak ji and Varun Singh ji, it really captured my imagination, and I felt so overwhelmed by their spirit of giving back to the society. In the times of extreme complexity and extreme uncertainty, everything was in flux. Their positive spirited effort served as a source of, as a beacon of hope and reassurance and strength to the local society. And I got myself so much like encouraging feedback that their efforts were shown as like giving a new lease of life to a lot of people who were feeling very hopeless and helpless. Also, this is a true example of self-driven. In Sanskrit, there is a saying, Atmaiva Atmano Bandhu Atmaiva Ripura Atmanaha. The best help that can be provided is to strengthen your own self. And the leadership, the vision that Dr. Mishra and his team displayed in bringing community together, showing the solidarity and reaching out to the most vulnerable sections of the Indian society, that needs to be studied better, that needs to be appreciated and acknowledged better. Our Prime Minister has given us a motto as a country, Sabka Saath, Sabka Vikas, Sabka Prayas, Sabka Vishwas. We all 1.38 billion people have to work together, whether in government or outside government, with same determination that no one should be left behind. And whatever we do must keep the last man standing in the thought process. There has to be a similar effort to reach out to the most vulnerable sections of the society, not only from the government side, but also from all Indians. And your example, Professor Mishra, has been an example, a shining model of self-help and vocal for local. How do you leverage very modest, very limited resources which are available locally to provide maximum impact, maximum support to the people who need it most? We have been a pioneer in frugal innovation, innovation which is not only relevant for the developing countries' needs, but also they are affordability. And your model of ICU on the road and providing healthcare consultancy and support to the people where they are, where they need the most. This is a very unique model of frugal innovation and service delivery. I think today's lecture will educate all of us about your initiative, your pioneering role in heartwarming social outreach and social support. And I do hope that the presentation you will make will give us new ideas to identify opportunities between India and Ireland, how we can use your experience, how we can use the experience of similar-minded NGOs and civil society organizations in Ireland to create a real people-to-people warm friendship. Once again, my very sincere gratitude to you, Professor Mishra ji, and your dynamic colleagues, Dr. Abhishek Pathak ji and Dr. Varun Singh ji. I look forward to listening your presentation with great interest, and we will have a lot of follow-up work to do. Thank you so much.
Thank you, sir.
Thank you, sir. Great word, sir.
I shall request the viewers, if they have any question, they can always type it in the chat box, which will be replied by Dr. Mishra later after his address. Now I request Dr. Mishra.
Sir, I am also joined with my senior colleague, Professor R.N. Chaurasia, who was former head and was also instrumental in getting this oxygen feriwala ICU on roads.
Chaurasia.
So, good morning to all of you at Ireland, and good afternoon to everyone here in India. Honorable His Excellency Akhilesh Mishra sir, Ambassador to Dublin, Ireland, Mr. Sahuji, and all the viewers, listeners. Great afternoon from all of us, our team, which includes Professor Abhishek Pathak, Professor Varun, Professor Anand, and my senior colleague, Professor R.N. Chaurasia. So what we will today, what we'll do, what sir said that how we dealt with COVID in limited resource setting. So the first I would like to tell you that the term here we are saying oxygen ferrywala. Ferrywala means something, one who goes to villages door to door to sell something like the day-to-day use thing. So we have taken the term ferrywala from that particular part. And what we have concept that ferrywala, our team will go to the door to door during the SARS-CoV pandemic. And then what we have managed will undo in our presentation. We'll open it up. Now, what we have seen that SARS-CoV, it affected India drastically with over 30 million positive cases reported till now. During the mid of this April and May 21, we had a second peak, which was affecting large population. And we are based here in northern India, in Uttar Pradesh, where which is having the population where a lot of positive cases and a lot of deaths were there. And the most difficult and challenging job was diagnosis, treatment, and referral in the rural area where the facilities were limited. So I will show you one video of our Honorable Prime Minister who did this video during that time only. So please listen first.
बनारस और पूर्वांचल के ग्रामीण इलाकों पर भी बहुत ध्यान देना है और अब मंत्र हमारा क्या होगा? जहां बीमार वहीं उपचार। जितनी हम उपचार उसके पास ले जाएंगे उतना हमारी हेल्थ व्यवस्था पर दबाव बहुत कम होगा।
So this is our Prime Minister. He came for a message to all of us, not only as a doctor, but everyone, every people in the society to come forward and to come with a thought of Jahan Bimar Wahin Upchar. Now, Jahan Bimar Wahin Upchar in English, it means that anywhere who is ill, you go there and provide the treatment, provide the diagnosis and treatment. So we thought that taking the diagnosis and management of SARS-CoV-2 to the doorsteps of rural area. So we thought that why not we should start teleconsultation. Then we started a WhatsApp video consultation. Then we said, why not we go for antigen testing in the rural area. And then the innovative idea came from all of us that why not we should make something which should have a oxygen sensors, temperature sensors, medicine, teleconsultation in one particular setup. And that we said as Mahamana oxygen van, that is on the name of our founder of BHU, that let's go with this van and let's treat them. And anyone who is sick, we should shift to tertiary COVID center with the oxygen less than 90. So what we could achieve, here is the data that over last April, May, we did a lot of screening and people, you see the mortality was too high. So next slide. So our approach was to, we should decided that we should go to the rural area with the name of oxygen ferrywala. So as people, ferrywala goes to sell their products door to door, we will go to door, survey for their hypoxia, survey for fever, and anyone who have low oxygen will provide the oxygen support immediately. And if there is someone to be shifted, we'll shift by any means from rural area to the main COVID center for admission in tertiary center. So we said this as a ICU on roads or ICU on wheel, that the doctor is there and consultation is there, and the management, the primary management, if hypoxia is like 94 to 90, we can give the oxygen supply over there. We can start the treatment over there. If patient is very sick, like saturation is less than 90, and this I am trying to tell during the course of peak pandemic, when the support, when our Prime Minister asked that Jahan Bimar Wahin Upchar. So this was our team that let's do someone is periphery care, and some of the teams were in the ICU. So we managed to join both of them. Next. This is something which Honorable Prime Minister conveyed in the his Man Ki Baat, that when he heard that someone have all gone. So here is one.
मरीजों के बीच जाना, उनका सैंपल लेना, ये कितनी सेवा का काम है। अपने बचाव के लिए इन साथियों को इतनी गर्मी में भी लगातार पीपीई किट पहन के ही रहना पड़ता है।
So when we went in the rural area, initially we started in 2 villages. Next, then we went next slide. Yeah, the next video which was came here in the national television.
प्रधानमंत्री के संसदीय क्षेत्र वाराणसी में बीएचयू के न्यूरोलॉजिस्ट डॉक्टर विजय नाथ मिश्रा के नेतृत्व में ऑक्सीजन फेरी वाला नाम के एक कार्यक्रम की शुरुआत की गई है।
अचानक लोगों का जब ऑक्सीजन गिर जा रहा है तो उनकी कंडीशन बहुत बुरी हो जा रही है और कई लोग मृत्यु को प्राप्त हो जा रहे हैं। ऑक्सीजन फेरी वाला का एक कंसेप्ट ये है, 2 काम करना है। पहला उनका टेम्परेचर लेना है, दूसरा उनका ऑक्सीजन लेवल नाप लेना है। मुख्यमंत्री योगी आदित्यनाथ जी ने एक नई शुरुआत ये की है कि जो सीएचसीज हैं उनमें भी करीब 50 बेड का कोविड वार्ड बन रहा है। So when we start going in villages, this was one paper cutting during that time. Next. So this was the prototype model. What we did ki we asked our Institute of Technology at BHU that whatever cylinders you have free, give it to us. We'll mount it on the small vehicle, and our volunteers will be there with the oxygen sensors, temperature sensors, and then we started delivering oxygen at their doorstep. And during that time, what we have seen that many patients with mild hypoxia, they were improved quite a lot, and we gave the supportive medicine. We said that why not you stay at home? We will give you the medicine, we'll manage you, we'll take care of you. Our team will take care of you. Those who were sick, next. So this was the prototype of during that time the oxygen model, and many patients who were not able to have transfer the ambulance, we also managed to get some vehicle, because in villages where there were narrow streets, so we did it with any small vehicle to shift. Next.
Professor, your slides are not coming. I think you have to stop the sharing of this video.
Stop the sharing video, then a slide will move. Yeah, will stop. Start. Is it seen now, sir?
Yeah, it is perfect now.
Yeah. Can you go back?
Please go back. Yes.
I can go back. So this was something. This was our. Can you see this model, sir? Sir, can you see this model?
Yeah. Yes.
Yeah, this is very prototype model, very basic model that we don't have anything else. So we brought some good auto rickshaws, brought our oxygen cylinders, the empty oxygen cylinder from our institute, and mount it on the these vehicles. It was supported by tele consultation pod, supported by oxygen sensors, temperature sensors, and then we went to the rural area. Initially, we thought that we should cover 2 villages, then we extended to 17 villages, and then later it went to 22 districts of northern India. And in next, this was the solution which we gave, that those who were having oxygen less than 90, saturation less than 90, we should shift them to the tertiary care. And in tertiary care, we have our team, Dr. Pathak, Dr. Varun, Dr. Anand, the core team, that those patients who will be shifted will be given the best treatment in the ICU. What we achieved that over last 16, 17 days of the crisis, we could screen around 47,000 patients. And this was one of the books which have just come out. It have also named this oxygen feriwala as one of the best innovations. So what we could achieve that in 17, 18 days, we could see for like 44,000 patients were screened. And to our thought, till now, up till now, no such effort of ICU on roads were there. So I will hand over the mic to Professor Abhishek Pathak, who was the key person for this ICU on road thought. So Dr. Pathak, will you please share your thoughts?
Hello?
Yeah.
Am I audible, sir?
Yes.
Yeah. So as sir told, no, there was the idea was to go door to door in a time when hospitals were full and all the medics and the staff, paramedic staff were overworked, overwhelmed with the crisis, with the increased number of patients. And we had the data that roughly 95-96% of the patients would just do with small antipyretics and small dose of steroids maybe, and a small bit of counseling. So that was the idea. And we tried to go the village, as I told, 17 villages, and we screened each one of them. And all the symptomatic patients were individually screened. We counseled them, and we handed over the portly, as we called. I mean, this is a small pack of medicines, and the medical pack that was available at that point of time, including ivermectin, paracetamol, with whatever evidence was available, and the drugs were in market as anti-COVID drugs. So we distributed them to the needy, and whoever and whatever patients required ICU care, tertiary care center, that was the vehicle which brought them back to a tertiary care center where our team, including all of us, were there on duties, and we were in constant talking terms with our central team in a ICU setting. And then we could transfer those patients who actually required ICUs to the ICU setting. And obviously the ICU team was at work giving their services at best. So this was this is what we did. But I would like, at this point of time, I would also like to add that even after COVID, now we probably, hopefully, we won't see such a crisis, and God forbid it happens. But what we believe is this model could be replicated in other diseases like stroke, maybe MI, maybe other respiratory conditions where, we all know the poor doctor to patient ratio. So this can be translated to other disease models with the facilities. And in fact, a few of the funding agencies have asked to upgrade the ICU, this small prototype model that we created. And in turn, this could be a task shifting where we could use this model to all the various emergencies in other specialties, as I told, in cardiology, neurology, respiratory medicines. So this is our future goal that we aim at. And we are in that process under the leadership of Professor Vijaya Nath Mishra, with our team like Dr. Anand, Dr. Varun, Professor Anand Chorsesar. We are working on it so that this could be an ICU on road, which could be used for all other emergencies where resources are poor, and we could treat them in the van that we have, and those who need it, we can shift them immediately to the ICU setting. Thank you so much, sir.
Thank you, Dr. Mishra.
Sir.
Yes.
This is what we have achieved. Our milestone, you can see, since 21 April, we covered 19 villages, screened around 40,234. Later, it became around 44,000. And 92 patients were detected with hypoxia. And sir, by God's grace and all the effort, 42 hypoxic patients, those were shifted to hospital, 37 were saved. And this is what the peripheral system, Johan Bimar Wahin Upchar. Next. There is Project X Factor. So I will like again Dr. Varun, Dr. Pathak to tell the Project X Factor. Can you stop the video?
So this, the X factor was, there were agencies coming up. They wanted a professional public partnership where they could help us. And in fact, we are in the process of, as I told, say the van could have a CT where we could get a crude image of brain and other organs at least, and especially in stroke, it would be just to rule out hemorrhage and we can thrombolize the patient, right? Target towards those who require it most. I mean, this will be target specific. There are many shortcomings that we have, right? And in fact, there are a lot number of shortcomings that we have, but gradually over the years and with the public-private partnership will be trying to solve those. How are we going to reach to those who actually require it, and what number of vehicles would be sufficient? And obviously, as I told in my initial, as I was talking, we need to translate this into other emergencies. The population is humongous, the poor doctor-patient ratio, we all know, the paramedic staff is less. I mean, we are a nation with poor resources, and when it comes especially to the health services. But these innovations like these, if worked with a proper public-private partnership, and if what we are dreaming, what Professor Vijaya Nath Mishra sir is dreaming of, if it comes out to be true, we'll be definitely able to help people in a better way. And then this could be translated, maybe a pilot study, our data would tell how it is helping. And maybe then it could be translated to other regions of the country where it could be replicated. So this is our X factor as we talk next.
Yeah, next. Let's go future prospects.
Yes, we have talked about this, future prospects. I mean, it will be a life-saving thing. We can translate it to other devices, and the innovation is still underway to have a mobile CT in the van, and maybe other defibrillators, other life-saving devices which should be handy and which should come up in the van we are planning. Next.
This is.
Thank you, sir.
Sir, this is one thing which we have achieved, that our George Institute have named as one of the best innovations in the COVID times. And next, sir, our paper on this particular topic have been also accepted in for publication of Indian Journal of Public Health. And before I end up, sir, for this publication, I will ask Dr. Varun Singh, sir, to just highlight about the publication.
Hello, good afternoon, sir. And last year, sir, around in the mid of the July, we accumulated all the data as described by Pathak sir and Mishra sir, and we submitted this in Indian Journal of Public Health, and it was with this data, and as sir told that about 94 to 96% of the patients were saved because of this innovation, and it has been accepted and is under publications.
And I request Dr. Chaurasia sir to speak a few words.
Good afternoon. Am I audible, sir?
Yes.
So this was the concept we have planned at that time during the second wave of this COVID phase. And because there are a lot of patients are coming there and waiting from ambulance to shift to the wards. So in our minds, this came that why not to at least start bridge over this oxygen treatment during this period. And we have started, and similar thing that Professor Vijaya Nath sir have also thought that why not to send such type of our portable oxygen cylinder with this temperature sensor to villages with few medications, common medications, and treat the patients if found positive there as such, so that there was so much panic situation at that time in the society, and everyone used to get the this oxygen at time with the time, and we can save at least this so many anxiety things and all this, because we have seen that very few percentage of patients require this last oxygen and all this. So we planned this and we worked in the periphery villages, and I think this was a good project, and we did and collected data and sent, as Dr. Varun Singh already said, for publications. So thank you from my side.
Sir, before I end up, I have Dr. Anand Kumar, who have joined during that time to our department as faculty. He came from All India Institute of Medical Sciences, Delhi. And when he joined here, the crisis was already there. So he was the key person to take care in the ICUs. So Dr. Varun and Dr. Anand. So I request Dr. Anand, few words before we end up. What was the thing, sir, in ICU during that time? And investigate.
Good afternoon, sir.
Yeah, namaskar.
Actually, this initiative works in a both way. As you had said, you had listened to sir, and he said that it touched almost more than 50,000 persons. And because of that panic, a lot of people, every time when the situation is like 98, 97, they panicked and they rush to the hospital, they try to get admitted. And this will create an unnecessary pressure to the tertiary healthcare system. So because of this particular innovation, this particular effort, they got assurance that if your situation is 97, 98, then you need not to rush to the hospital. And ultimately, the burden on the healthcare system, tertiary healthcare system, has been reduced drastically. And we get a bit of, although the flow was very much high, but still the significantly reduced because of this innovation, because the patients get primary basic treatments at their doorstep, and only those patients were shifted who really need an ICU care. And definitely we are able to provide a better healthcare system for those who are really in need. And thank you, sir. Thank you for this reason. And this all effort has been, you had seen it, appreciated at every basis. So, but we really need a such type of initiative in a larger scale for the other emergency conditions also. Thank you for your insight.
Limited resource setting country. Sir, I have one word in last. That sir, Pradhan Mantri ji ne hum log ko kaha tha, pure desh ko, he said to all our nation that let's join and jahan bimar wahan upchar. We did it from our thought. It's supported patient. It made our COVID tertiary care hospital pressure less. So I think we have done something which was giving life to many. But I appreciate our Honorable Prime Minister, Honorable Chief Minister, and all the government officials, that the way they have also supported all of us. That was great. And before I end up, I say, Satyamev Jayate and Jai Bharat.
Thank you, Dr. Mishra. There is no question as such. I can't see any question, but yes, Dr. Hemant Kumar, he has written to Dr. Mishra. Thanks for helping us for our visit to Varanasi. You did organize a visit to Chitrakoot. This is written by Dr. Hemant Kumar. Okay. So thank you.
Yeah, so if there is no question, then let me once again express my very sincere thanks to Professor Vijay Mishra ji and Abhishek Pathak ji, Varun Singh ji, and Dr. Anand ji for sharing your thought, very pioneering initiative with us. As I said earlier, I, as an outsider, I see this as a very, very interesting, unique example of frugal innovation in the niche area of medical healthcare service delivery. I have not seen any more successful, more timely intervention from the self-community driven.
Most timely intervention.
Yeah, and also entirely driven by the community leadership, reaching out, caring for the most vulnerable sections, and that last mile delivery of services in healthcare segment. This was extremely important, and the success of your initiative is not because you got vans and you got rickshaws. The success, as they say, success is from the your atmik shakti. Karya siddhi sattve bhavati nopakarane. Success of great people is not because of what kind of resources they get. So I can see the vision, the passion, the sincere commitment to give back to the society and genuine sense of compassion and kindness towards the people who are in the need. That makes your initiative very distinct from many other NGOs who are existing in India and other countries.
It's because of all of us.
Yes,
it's because the whole team is there, sir.
Absolutely. And that team effort, the spirit behind the team, that made the difference. Yes. And also, I would very much like to have a copy of your presentation, because that will be easier document to disseminate. I would very much like it to be known among healthcare circles in Ireland. And that could, in fact, pave the way for India-Ireland sharing in the non-governmental sector in healthcare. I do believe that the example that you have shown in terms of taking everyone along as one big team effort, sabka saath, sabka vikas, sabka vishwas. This is a very inspiring, heartening example. And I'm also very deeply inspired by your commitment, your service to the society and service to the nation. This example needs to be replicated in many segments. And I wish I will do my homework on Ireland side and get back to you on what we can do next. All the very best to each one of you. We are so proud of your exemplary service.
Thank you, sir.
Thank you, sir.
Thank you, Dr. Vijaya Mishra. Thank you, Dr. Abhishek. Thank you, Dr. Chaurasia. Thank you, Dr. Anand. And thank you, Ms. Nidhi, for all your service to India. Thank you.